prior to this epidemic, no one knew what epidemiology was or what an epidemiologist did, right? And so now all of a sudden we're at the forefront and doing all this work. And a lot of the work that we're doing is behind the scenes with the data and trying to make sense of that. And I think the idea, especially lately in the political environment and trying to get a vaccination out, is data-driven decisions are on the attack. And I think we need to really, really be careful about how we pursue things or allow things to be pursued without the correct information, the information that has been adequately assessed to produce the best results. And as a result, I mean, if we do not do that, I find that the populations that are going to be impacted the most are those that are of ethnic minority populations, or those populations that we have ignored. And I think everything that Ben was talking about plays into some of the barriers and some of the necessities as to why we need to really focus our attention on communities of color. I'm doing some work right now on with COVID-19 Prevention Network, where we're assessing and providing recommendations to all the clinical trials and their protocols and informed consent. And it's really interesting to see and to read the information that is being provided by the pharmaceuticals and the stuff that is just not being addressed, or stuff that are not taken into consideration. I mean, in simple things of accessibility to resources, understanding why it's important to really explain these protocols and to explain what the immunizations, vaccinations can or cannot do, and understand the historical trauma that has created this fear for the work that either science, medicine does because of bad behavior, going back 400 years, and taking advantage of people, communities of color. And so without understanding all of that, I think it's really hard. I mean, being in conversations with like the pharmaceuticals and with colleagues, that just goes over their head. They don't even take into consideration any of the stuff that we're talking about. What they want to do is push things out and get people vaccinated, testing, so that they can have something to say that, okay, here we have a vaccination on COVID-19. But I do think that communities of colors are going to, if we don't do this correctly, are going to be the ones that are going to be most impacted and affected by it.